Head of Startup Battle Asia. And now let me introduce my colleague, Anna Fedorova, Chief Partnership Officer of Startup.Network and the CEO of Unicorn Cup. Anna?
Hi, Lena. Hi, Kate. Oh boy, am I glad to see you all, guys. In a new season of our Unicorn Cup. And of course, everything that you are part of is happening thanks to our sponsors that are supporting us. Network VC California Seed Fund is Global Platinum sponsor. Global Golden sponsor is Silicon Valley Syndicate Club. And Global Silver sponsor is Silicon Finance Pre-Acceleration Program. And I'm really glad to tell you that our Unicorn Cup is the world's largest startup pitch event in 2020. We had managed to visit the most places as anyone else in the world and had held a lot of battles online, more than anyone else. And this is already the second season of the Unicorn Cup, and we are doing vertical battles on 4 industries. And we'll be visiting 5 continents, almost 125 countries of the world. 200 startups will be pitching live that will be selected almost from 1,000 applicants. And we will have a lot guests online and offline watching us in our broadcast. So this season, we'll be doing Healthtech, FinTech, AI, and we will have general industry agnostic battles to help you to find the best innovative solutions and best startups that will define tomorrow's future. And all the best things in the world are happening when we have our partners by our side. So we will really be glad if you will join us and be our partner for this season, for the next season. Please approach me or our event managers, and we will gladly continue to talk to you about that. Let me introduce to our ecosystem. Most of you know already that we are in an ecosystem of online solutions that helps startups, real businesses, investors, venture funds to solve almost any task in the field of innovation. The heart of our system is a marketplace, Startup.Network. Startup.Network is a great place for the startups, businesses, investors, business angels to find the perfect match and solve their problems, like for investing into startups, finding the best opportunities. And our network has reached almost 1 million users. And Unicorn Battles is the oldest part of our smart family, and it's a great opportunity for the startups to show themselves for the whole world, and for the VCs to find really great opportunities, and for the angels to see what startups will outline tomorrow's future. This season, we'll be visiting 5 continents, screening all countries where prominent startups exist. And we had been doing our battles for 11 years already, had held more than 220 of them. And our winners had managed to raise more than $120 million. And we have really great VC community and really extensive angel network in all the places in the world. The special program, Silicon Finance, had been created recently. We help startups to relocate to the United States, grant them funds and services worth $50,000, and help them to apply to top American accelerators. The recent part of our smart family is Network VC California Seed Fund with 2 current strategies. First one, to participate as an investor in our pre-acceleration program for the chosen startups, and second one, to be a lead investor in our Silicon Valley Syndicate Fund. And Silicon Valley Syndicate Club is a special structure that allows venture syndicates to be easily organized. And now any investor starting with a little check as $10,000 is able to join our syndicates to get an access to the best startups that we had found through our global network. And also, I would like to introduce you also to a really important part of our smart family is VC House. VC House is an invitation-only community for the VCs, where they can be introduced to each other and exchange deals that already they participate in themselves. It's also a platform for specialized offline events where VCs can find investors for their fund. Thank you for joining us today. Thank you for listening to me. And I would like to return the floor to our wonderful hosts for today, Lena and Kate. Girls, floor is yours.
Thank you very much, Anna. Nice to meet you all, guys. I want to express my gratitude to the community partners of our today's battle. First of all, to the Plug and Play Abu Dhabi Global Market and GHV Accelerator for its support and developing startup ecosystem around the globe, and especially in the Asian region. Also to compliance platform Clean that is easy to understand, looks good and protects your business immediately. Advise you to check its website. And to our Healthtech friends Galen Gross and Blue Chili, by the way, representatives of these organizations will also be on the judge board today. How are we going to move on? Now each judge will introduce him or herself, then we will listen a pitch session of the top 10 startups from the Asian region, Healthtech startups, of course. And after the jury voting is done, we will find out who was able to catch this train and who will take part in the Unicorn Cup final on November. And at the end of the event, we will have a networking part where you can hear some VC insights and discuss with our judges some investments topic. So have a good day or evening, depends on your time zone, and relax. Thank you.
Thank you, Kate. Thank you, girls. Before we'll start the pitch competition, please greet our honored judges who volunteered their valuable time to our event today. Dear judges, please introduce yourselves and your funds you representing very shortly, pointing out the industry, check size, state, and geographical location of startups you invest in. So, Alexander, could we start from yourself?
Oh, you're muted. Can you please unmute yourself?
Sorry. Thank you very much, Lena. Hello, everybody. Our fund network VC usually invest up to 250K. We are industry agnostic, and geographically we prefer to invest in US or Europe, but we started to look for startups in Asia region as well already. Thank you very much.
Thank you, Alexander. Welcome. So, who would like to be the next one?
Pretty.
May I? Thank you
Yes,
very
please.
much, Alexander. Thank you. Hello, everyone. My name is Preeti Chaudhary, and I am logging in from India today. I am the founder of LinkedIn Local India and an investment alliances and partnerships head for InfoCrest. My areas are sector agnostic startups, ticket size of $25,000 to $150,000. Again, looking for some growth stage, not exactly ideation or before. Very happy to be here today. All the best to everybody participating, and everyone is a winner today. Thank you very much and have a good day all.
Thank you, Preeti.
I can go next.
Yes, please. Yes, Pierre.
I can go next. My name is Pierre Martinsson. I'm based out of Singapore, and I represent the company called The Scale Factory. We invest and we help companies scale in the Southeast Asian region. We do investment from 50 to 150 US, primarily looking for B2B tech companies who has some element of innovation in their value chain. Thank you very much.
Thank you so much. Welcome. Welcome.
I'll go next. I am Pradeep. Actually, I am the Chief Innovation Officer of LivePure India Private Limited. We also have a family office where we invest typically in a startup in a majority stake. We don't invest usually in a minority. So, but we look at startups which are looking for the B2C kind of consumer connect and the market access, and that technology we can take it all the way for our market. And our area of operation is health and wellness, air and water, batteries, inverters, electric vehicles. So these are the areas which is of typical interest. I look forward to see me and my group actually.
Thank you so much, Pradeep. Thank you. Welcome.
I could go next. Hi, my name is Kailash Nath. I am part of the investment team at Bharat Innovation Fund. We're based out of India, and we are focused on investing in companies with deep technology. So we look for globally competitive technology IP when we evaluate and invest in companies that we end up investing and supporting. We're a sector agnostic firm, but we have special interest in healthcare and life sciences. We invest at pre-Series A, Series A, and Series B stages, respectively. And we invest anywhere between $1 million to $2.5 million. We have gone to $3 million in one of our portfolio companies. Typically we reserve about $5 million in dry powder in our follow-on rounds. We have about 7 companies in our portfolio at this point in time. We look forward to making many more investments in the next 2.5 years or 3 years of time. Happy to be a part of this event, and thanks a lot to the organizers for the invitation, making me a part of this event. Thank you.
Thank you so much and welcome.
Can I go next? This is Vikram. Vikram from GHP. I'm a founder of GHP, and we are into 3 areas of business. We have an accelerator, industry co-creation program for large enterprises, targeting innovations from India for the global markets, and we have a seed fund. And our size is from $50,000 to $250,000. We have more than 20 portfolios right now, and we are sector agnostic. Look forward to be part of this battle today.
Thank you so much. Welcome.
Can I go next? Hi, my name is Celine. I'm based out of Singapore. I have my own startup in the education space. My investments are up to 200,000. I'm sector agnostic, but have a preference towards startups that are working on something that has social impact to society. Thank you.
Thank you so much, Celine. Thank you. Welcome.
I could go next.
Yes, please, Farad.
Hello. Good. Am I audible?
Yes, please. You could start.
Okay. So a very good afternoon to everyone. And I'm Rahul Mandal, and I'm based out of UAE. I'm currently with a government entity called RAKEZ, which is the Ras Al Khaimah Economic Zone. And I have about close to 7 years of strategy consulting experience. So especially towards healthcare and industrial and manufacturing. And I look forward to being part of this competition. And thank you once again for inviting me.
Thank you so much.
I could go next.
Yes, please, Luis.
Just to continue on the UAE. So hi, everyone. Very excited to be here. Thanks for organizing this. I represent Plug and Play. We are the most active VC in the world. We make around 250 to 300 investment per year. Our ticket size range from 50 to 150K USD, and we invest across 18 industries. Now for Plug and Play MENA, we tend to focus on fintech, travel, health tech. We're stage agnostic and sector agnostic, but we have a preference for these 3. And yeah, very excited to be here with you today.
Thank you so much. Thank you and welcome.
I go next.
Yes, please.
Hi, so continuing on UAE as well. So hi everyone, my name is Hisham Zreik. I'm CEO at Healthtech Capital. So Healthtech Capital is an online incubator based out of UAE. We operate globally. We have several programs. The oldest one is where we become the technical co-founder, invest 50% of the money needed and do the whole technical development from A to Z. We have already more than 20 startups that are graduated and one successful exit. We have helped more than 400 startups in total. We are stage agnostic, country agnostic, and industry agnostic. We invest from pre-seed funding to Series A. Our ticket size is between 50K to 2 million per startup. Personally, I'm an angel investor and was ranked on top 50 angel investors according to Forbes. Thank you.
Thank you so much. Welcome.
Hi, I can go next. This is Shailesh Gorpade. I am a founding partner at Xfinity Venture Partners. We are based in Bangalore. We actually started in 2014. Our thesis has been largely to back B2B deep tech enterprise tech startups, which primarily work in the Indo-US corridor. So we have been funding companies in India, US, and Singapore. We have an active portfolio of about 20 companies right now, and we fund our check sizes are between $500,000 to $2 million.
Okay, thank you so much. Welcome on board.
Yeah, I'm Gary Fowler, and I'm a serial. Can you hear me?
Yes.
Yeah, I'm Gary Fowler. I'm a serial entrepreneur. I've done 15 companies. I'm now on my second unicorn. My company that I was on the original management team of, Click Software, was sold for $1.35 billion a little over a year ago. I'm based in Silicon Valley, although today I'm in Palm Beach, Florida at my house. So it's, I have two funds. I actually have my private money in one fund, and my other fund is a $100 million fund that we're building in Atlanta, Georgia. I started the first accelerator in Russia and the largest private corporate accelerator. And now I have GSD Labs, which is a virtual accelerator that we put together. We're looking for incredible companies that want to go global. We believe that the world is without boundaries, and there's really, the digital transformation has given us an opportunity for the democratization of opportunities. So we're looking for resilient teams. I'm a writer also. I've written 74 articles in artificial intelligence in the last year. I have a show, by the way, on the 22nd. Guy Kawasaki will be on my show in Silicon Valley for all of you that are interested. But this is a great opportunity for all of us with this digital transformation to get the word out and connect with investors and startups from around the world. Thank you.
Thank you, Gary. Thank you.
Hi, Elena.
Hi.
Hi, Elena. This is Bharat here. I'm personally a serial tech entrepreneur, been through 5 exits and 2 IPOs. And currently, I run a global program called the 100 Open Startups, which is the world's largest open innovation program. 5,000 corporations are part of the program. And we help startups all over the world in about 198 countries to find markets as well as to find investments. And so we have a 100 Open Angels fund, which is a 200 million fund that we invest into all kinds of technologies. It's sector agnostic and tech agnostic. And nice to be here once again. I'm no stranger here. I'm somebody who comes regularly on these demo day pitches. So I'm happy to be here again and look forward to meeting some great companies. Thank you.
Thank you, Bharat. Welcome. I'd like to go next.
Hey, I'm Fethi from Georgia. I'm co-founder of Impact Hub Tbilisi, which is a co-working space that aims to empower startup ecosystem in our country. We are mainly focused on business ventures that are aimed at social entrepreneurship. I'm happy to be here. Thanks for the opportunity. Looking forward to hearing nice and interesting ideas.
Thank you so much. Thank you.
Hi.
Elena, I could go next.
Yeah. Hi, I'm Janet from Singapore. I'm the CEO of Venture.Network. Happy to be here. We represent a handful of investors and fund houses here in this region. to assist in sourcing and funding, particularly we are into post-seed and Series A. So we're now in the midst of actually digitizing our work process to better serve the industry, the investment industry. So we have just revamped our website and to expand our outreach and also build out our investors in the circus. So we welcome everyone here to join our website. To sign up, as investors, project mentors, or even advisors. After all, investment space is about building relationship, networking, and collaboration. So during this initial trial period, we are opening up for free membership. So do take up this opportunity to sign up and visit our website. Thank you so much.
Thank you so much. Welcome. Welcome, Janet.
Hi, Elena. I could go next to this brother here.
Yes, please.
Hi, good day to all. My name is Subrata. I'm based out of Bangalore, India. I'm a venture partner of our Ventures, which is one of the largest fundraising platform for early stage startups raising up to $10 million. In addition to investment management, I have led business operations previously. I specialize in deep tech, health tech, and enterprise SaaS. Looking forward. Thank you.
Thank you so much. Thank you. Welcome.
Yeah, maybe I can go next.
Yes, please, Paul. Yeah.
Hello, everyone. My name is Paulina Białek. I'm director at Expara, Singapore-based venture capital fund with offices across Southeast Asia. Currently, I manage Expara VCs Global acceleration program dedicated to startups developing solutions for a post-pandemic world. We invest at seed stage. We are sector agnostic. We invest from 50K to up to 1 million USD. And we invest mainly in Southeast Asia, but our acceleration program are open for startups from all around the world. Thank you very much for the invitation. I'm looking forward to today's speeches. Thank you,
Pauline. Welcome on board. Who would like to be the next one, guys?
I'll go.
Hi. Yes, please.
Hi, my name is Jeffrey Hansley. I'm a GP at Untitled Capital based in Shanghai. We're a founder-driven fund. We invest from seed to B. Ticket sizes 50 to $1 million. 4 main themes: care, which is healthcare, elder care, childcare, insurance, insurtech, through to culture, consumption, and creation. Creation is focused mainly in deep tech, agri, and EV. We're slightly unusual for a fund in China in that all of our partners are founders, serial entrepreneurs with exits and including acquisitions, IPOs in the States, Asia Pacific, as well as 2 of the largest unicorns, founders of 2 of the largest unicorns in China. Looking forward to seeing what's going to come out today, and also looking forward to being in touch with the rest of the esteemed judges in this group. I think it's a great opportunity for us to communicate with each other and share knowledge and opportunities. Thanks very much.
Thank you and welcome.
Hi, I could go next. I'm Dr. Hi, Lena, nice to meet you. I'm Dr. Ruchi Dana. I'm logged in here from Dubai. I'm actually a medical doctor, so I'm really excited about the pitch competition today. It's Healthtech. I'm also a Stanford MBA, and I'm really interested into startups. I represent our own family office, Dana Group, here in Dubai, and we invest mainly into the medtech life science sector. So I'm really excited, and our ticket size ranges from $250,000 to around $1 million for early stage startups, and we also do some pre-IPO deals. And I'm looking forward to it. Thank you so much.
Thank you so much, and welcome. Would like to be the next one?
Yeah, hello, I'm Trúc from Do Venture. So we are the new, actually we are newly launched fund, 50 million US dollar fund in Southeast Asia with Vietnam focus. We regarding to the industry, we are quite industry agnostic. Our check size will vary from 500K to up to $3 million US dollar. So yeah, so nice to meet you, all of you here, and looking forward to have an opportunity to work together to co-invest in the future.
Thank you so much, and welcome on board.
Great, I can go next, Elena.
Yeah, yes, please.
Hi, hi everybody. I'm Fredrik Tuck. I'm from Maersk in Copenhagen, Denmark. working as head of innovation scouting. We're always on the outlook for interesting startups to cooperate with and to long-term invest in as well within different areas, as we are diverging into many interesting areas. Great to be here. Great to see the judges again, and hopefully looking forward to a lot of good presentations from the startups.
Thank you so much and welcome. Next one, please.
Hello, this is, sorry, you first. Yes, thank you.
Oh, go ahead, Colin.
Yeah.
Okay, thank you. Hello, thank you very much. Hi, this is Colin here. I'm from Untitled Capital. We mainly help a few family offices to invest. I have over 20 years of experiences into the early stage investment and have helped more than 10 firms to go IPO or M&A with other companies. So I do look forward to hearing good investment opportunities here. Thank you.
Colin.
Lisa?
Thanks, Selena. Thanks for the invitation. It's a great pleasure to be with you today. I'm Lisa Salud. I'm the general partner of R3I Ventures. We're a deep tech, med tech, cross-border impact firm, and I'm the chair of the House of MedTech and House of Deep Tech launching in Luxembourg. We really focus on connecting deep tech and healthcare companies into the fabric of the European Union and then cross-border scaling them into the US for the exit. I'm partnered with Henry Wong of formerly Garage Tech Ventures, and we're focused on investing in Europe, the Americas, and Asia. Our initial check size is typically 500,000 through to 2 million. And we are active investors, so we're not coming unless we're at the table and we're building. Great to meet you all here today and look forward to syndicating with you in the future.
Thank you.
I figure I'll go after a good friend. Hi, I'm Joseph McAnu here, founder of Verge Healthtech Fund. We are a seed stage only venture capital fund that invests globally in anything technological that expands access, quality, and efficiency to healthcare. While we don't necessarily hunt for unicorns, we won't say no to them. We just are looking for seriously impactful solutions that will help millions of people and hopefully get us a good return in the process. Typical check size is between 250K to 750K USD. And like Lisa, we're very hands-on. All of us are founders and come from industry.
Thank you, Joseph.
Thank you so much. Who would like to be the next one, guys?
Yeah, Francis.
Hi, everyone. So I'm Francis from Manila.
We don't hear you. Sorry.
Can you hear me now?
A little bit
louder. Can you make it louder a little bit?
Can you hear it now?
No.
Let me move. Sorry.
Yeah, maybe you can unplug your headphones. Maybe they're interfering.
So maybe let's continue. Yes, please, guys, who would like to be the next one? Francis now have some technical problems. Dear judges, who would like to be the next one?
I can be. I'm from Istanbul. This is Ömür. Hi, everyone. I'm running a venture building studio for the last 5 years. We are mainly focused on fintech, smart cities, green technologies, and everything which has analytic and data side. We are covering 16 countries, mainly in Southeastern Europe. And this is my second judge. I was also in the Istanbul competition.
Yeah.
So I wish everyone a successful journey.
Thank you. Thank you so much and welcome. Would like to be the next one, guys?
I can go. Good morning, everyone. I'm recently in Toronto. I present R3I Ventures. We focus on deep tech, health tech, cybersecurity, early stage, investing in pre-seed, seed up to Series A. and we focus on Asian, European, but also American market. So we're pretty much spread globally.
Thank you, Peter. Yeah. Next one, please.
Hi, Alina. Thanks for having me. I'm a principal at Bling Capital based in San Francisco. We're a $100 million seed fund. We typically we typically lead seed stage rounds and are sector agnostic. And for support, we help our portfolio companies find and scale product market fit. Nice to meet everyone.
Thanks. Welcome. Welcome. So, Francis, are you with us? Maybe you try again. No, it's some problems. Okay.
Hi, I'm
yes,
Savaş,
please.
Founder of Untitled Global Ventures in Toronto. We are also looking at startups, not the seed, but able to.
Excuse me, Savas, it's some problems with your internet connection.
Savas. Is that right? Okay, I'll try again.
Yeah.
Can you hear me now?
Okay. Yes.
Can you hear me now?
Yeah, you can start. Yes, Savas.
Again, Untitled Global Ventures in Toronto, interested in AI, IoT, and fintech companies in the startup stage. And thanks for the invitation and good luck to all the participants. Thank you.
Thank you. Thank you so much. Yes,
Can I try again?
Yeah, Francis.
Sorry about that, guys. Yeah, I just switched to my iPad. So I'm Francis from Manila, Philippines. I represent a venture studio called Warpgate Ventures. So we're I would say, tech investor in the sense that we invest technology and the products into companies that we build. We do that in 30 to 90 days using our proprietary systems that we are able to build Lego type systems so that we can build it pretty easily and fast. I also represent a venture capital called Unifier Ventures. It's a Berlin and Manila based fund that invests into HR tech. So yeah, hopefully I could connect with all the judges here who want to invest into the Philippines and be nice to collaborate together.
Thanks.
Thank you.
Okay. Anybody else? The judges? Okay, so.
Yes, actually, yeah, my name is Bassem. Hi, Kate. Yeah, my name is Bassem, one of the judges. I'm based in Dubai, running a boutique private equity investments and advisory firm called Aster Global Partners. We work with a lot of families in the region based in Dubai, Saudi Arabia, Kuwait, Qatar, and we're also very well developed, or I've been running a healthcare investment and advisory firm as well. So we focus on healthcare, health tech, ed tech, as well as real estate. Those are the three areas that we've been focusing a lot on. And we've got bridges that we're building between the Middle East and Canada as well. And we're very keen on exploring the Asian market. So this is really exciting and lovely to meet everyone here.
Okay, thank you so much and welcome on board.
Thank you.
So let's move on. Yeah, let's continue. So guys, before we start the hottest part of our event today, let me explain you a little bit about voting system today. So dear judges, to start voting, you have just to click the link you have got on mail and get access to the profiles of today's startups. After every page, you have to put mark potential of startup. From 1 to 5, where 5 is the highest mark and 1 is lowest. You have just pay attention that you have just put marks without any confirmation bottoms. If you could change your marks before the voting will be closed. If you will have some questions or some problems, our colleague Julia can support you. Just tell about it in our chat. Next information is about for our attendees today. So, dear attendees, you have a great opportunity to support our participants. For it, to do it, you can just register at event page and give your likes to your favorite startups. They really need your support. Today, we have 10 participants, 10 startups. Every startup will have 3 minutes for the pitch and 3 minutes for Q&A from our dear judges. So that's all from my side. And Kate, could we start?
Sure. The first one is Miracle.
Hello.
Are you with us?
Yes. Hello. Let me share my screen. Can you see this?
Yes. Good luck.
Okay. Hi, everyone. I'm Rachel, the founder of Miracle. Chronic respiratory disease is a huge and growing problem. It affects more than 600 million people globally. It can't be cured, but it can be controlled with medication and management. However, current methods are flawed. Half of patients inhale wrongly, so the much needed drugs end up at the back of their throat and not in their lungs. A large proportion also don't take them regularly, and because of this, 7 in 10 have poor control, causing worsening of symptoms such as shortness of breath and hospitalization. Meet Chris, a 4-year-old with uncontrolled asthma. She has been using the inhaler, but she's not getting better. Cases like Chris are more common than you think. 14% of children globally has asthma. We founded Miracle to help cases like Chris, and we can achieve that with our deep experience in medical device industry. Victor has founded 2 successful companies, Melvin has commercialized 11 novel devices, and I, Rachel, have deep experience in product development. We introduced the WIS, a smart spacer that reinforces correct inhalation technique, providing Chris immediate and actionable feedback. So similar to speedometers in cars, she will intuitively know when she's inhaling at the optimal rate and when she's not. And her mom can be assured that medication is delivered deep into her lungs. The spacer is paired to a mobile app that makes compliance easy, trackable, and fun. Daily alerts simplify treatment, and rewards function motivates her. This accurate and objective data is shared with her doctor to help him conveniently track and evaluate progress to adjust treatment more effectively. Imagine what more we can do with this data. The WIS is effective. Through our trials, we have shown patients overcoming the hurdles in compliance and technique. In just 3 months, the WIS directly improved asthma control and reduced symptoms. Parents are telling us that they need the WIS now. We have key opinion leaders in Europe, Asia, and Australia confirming that this dual-pronged approach is critical. This will help drive patient adoption. So how is the WIS better? It is the only solution that addresses technique and compliance at the same time. Smart inhalers help to monitor compliance, but tracking is a non sequitur if medication is not even delivered correctly in the first place. Regular spacers do not offer any feedback. Due to the high prevalence of respiratory conditions, the market size is significant. We have a $1.1 billion opportunity by just capturing a 5% market share. The WIS is a complete business model with the spacer sold to patients and the recurring revenue from the replacement chamber and the mobile app subscription. Our go-to-market strategy is to deliver the solution to customers via multiple pathways. We are Miracle, and we are solving the treatment of chronic respiratory disease in a $48 billion industry. Join us as we liberate patients like Chris to live their fullest life. Thank you.
Thank you, Rachel.
Dear judges, any questions?
Yeah, hey Rachel, nice to see you again. A really quick
Hi.
one. The training persistence, I'm curious if you're using the spacer, how long do you need to use it in order to kind of get the good inhalation technique, and how long does that good technique last for? And forgive my ignorance if it's a dumb question.
No problem, no problem. It is because it's a real-time feedback and it's intuitive. We've seen children as young as 4 years old actually use it and instinctively know when to inhale correctly. So we will say immediate, if not the first few times, you should be able to get it. As to how long it will last, our question to you is that will you take away your speedometer in your car just because you kind of know how fast to drive? No. So in the same sense, we wouldn't take away the training feature out. We will always have it there so that they will always be reinforced with the correct technique. Yeah. So it's not something that we want to remove and bring back again. I hope that answers your question. Yeah.
Rachel, my question is, do you recommend this application also for old people who have, difficulty in doing on their own and somebody else is monitoring through remotely, etc. So is it applicable for that kind of use case?
You hit the nail Pradeep, because yes, we are also addressing the other side of the vulnerable population, which is the elderly. So chronic respiratory diseases somehow affects these two population, the very young and the very old. And yes, the very old also have problems with coordination and as well as correct technique. So they are also a market that we are trying to address.
Okay, good.
Thank you.
Hi, Rachel. I would love to know, like, you had a segment called agnostic. So what did you mean by that?
Sorry,
in the
can you
competition
repeat?
slide? In the competition slide, you had a column called agnostic. So what did you mean by that?
Okay. So it's inhaler agnostic, because there are 140 types of inhalers in the market right now. And our device is designed such that it can fit any inhaler that the doctor prescribes. So it follows the patient throughout their history. And even though the doctor may change the dosage and medication, they can still use it. And I think this addresses some of the smart inhalers, which are very specific to specific medication. So once that is changed, they can't use it anymore.
Rachel, one question.
Yes.
You were saying that the prototype is ready in your presentation. Am I correct?
Yes. The product is ready.
Product
it's not
is
even a prototype. Yes, it's manufactured right now. Yes.
The unit price is $79. That's for South Asia market, I believe, that pricing.
Yes.
And have you make a survey of the sales survey, like how is against the competition? Because the product is custom product, and there's so many other, as far as I know, products.
Yes.
What's your major difference from the others in that sense?
I guess in terms of the competitors, right, the closest are the smart inhalers, and they are currently being sold for around $100 at the moment. So we are trying to be comparable to them as well. And also, I think when we talk to customers, we did find that the range that they are open to is within like $100 to $150. Yeah.
Okay, thank you.
Thank you, Rachel. Thank you for a great speech. We need to go on. And the second one is Sergey.
Yes, hi everyone. Nice meeting you. And let me share my screen real quick. There you go. And you should be able to see it now.
Yes.
You see it? Okay, great. And let me time myself as well to be 100% correct. Hi everyone, my name is Sergey, and I'm a CEO co-founder of Genesis. And at Genesis, we're building the end-to-end ecosystem to accelerate collaborative research between institutions. Now, let me guide you through real quick. So our vision, ultimately, is to equip research institutions with means for compliant clinical data or clinical data asset showcasing, study sponsor attraction, and facilitation of collaborative research. Now, our team of 14 people has pretty much different angles of experience around pharma, around clinical data, and around medical devices. So we've thought, well, what are the major issues that prevent research institutions to showcase and share their clinical data assets with study sponsors directly? We have found out that there are essentially 4 problems: data fragmentation, traceability, and data being siloed in the institutions, conflicting regulations across the jurisdictions, patient consent that is very old school right now. It's not digitalized. It's not essentially recorded in a digital way. And then the cadence of collaboration cycles that is very slow between the institutions. Now, what we have built at Genesis and validated already is our own vision of our ecosystem, or an end-to-end approach, where we focus around 2 key products of ours. One is Genesis Curator. Now, Genesis Curator is basically a handshake space for data publishers, such as biobanks, hospitals, research groups, or even patient associations, and the data acquirers or study sponsors that are willing to query through the data and clinical data assets that the data publishers have and request them directly from the data custodians or the institutions that are holding the data. We would then equip the actual institutions, the data publishers, with our second key product, which is OneGenesis Themis, and that is our own in-house built proprietary consent management solution, which provides end-to-end digital consent management and is regionally adaptable to fit the regulation you basically need. We earn our money twofold. We can sell our consent management products as a software as a service, which is a very transparent and understandable model. And the OneGenesis Curator, the dashboard, is basically monetized through subscriptions from the study sponsor side. So pharma companies are paying us money for using the Curator interface. We would also charge them success fees for successfully recruited patients or data sets acquired. Now, our use case highlights to date include the consent data curation for the UAE government, for the Latvian government, multiple partnerships with the South Korean institutions. We're also the COVID phase 3 clinical trial consent data curator as we speak, as well as the partner for multiple patient associations around the globe. We've been to 500 startups, MedTech Innovator, EIT Health in Europe, and we still believe the best is yet to come. Our first revenue was in 2019. We currently have around 800K patient data reach as of now and are present on 3 continents. We're targeting $2 million USD in revenue for 2020, at least pre-booked. And I'd be happy to answer your questions in the session afterwards. Thank you very much.
Thank you so much. Great
That
pitch.
makes it 3 minutes.
So, the judges, do you have any questions?
Yeah, hi, this is Shailesh here. My question is, what is in it for the hospitals or clinics to share the data? So how are you compensating them, or, what hurdles do you see in getting data from hospitals? Because this was one area that we found in India, which was a problem.
Sure. Thank you very much for the question. So there are 2 tricks for that. First and foremost, we do not ingest any data. So what OneGenesis does is we operate with descriptive metadata metrics, like if you wish a stock inventory of what the hospital actually has, because you're not allowed to take the data out of the hospital, so we don't store it in the cloud. So it's totally safe for the hospitals to showcase anonymized metadata metrics. Now, the way hospitals monetize is they basically attract more clinical trial research to their sites, because hospitals here are acting as clinical investigators. So essentially, if you are a hospital and you have patients or you have data sets that you are willing to share, but you don't know how, if you are able to expose them and attract sponsors to your place, you're basically getting paid by pharma or CROs for enhanced clinical trial activity at your site. And this is how hospitals monetize. And then the other part is hospitals are also leasing data. So they can actually lease a data to a data set to a pharmaceutical company that is willing to run, let's say, an AI model on it. And this is how they monetize as well. And they're absolutely safe in the process because data still would not leave the site. Yeah, if that answers the question.
Okay, thank you.
Thank you so much. Any questions else? Yes, please, guys.
If nobody has questions, thank you, Sergey. Thank you for great pitch. And the next
Awesome.
one.
Thanks a lot.
Thanks. The next one is Carl from the startup. Carl.
Yes, that's me. How you going? I'll share my screen. Can you guys see?
Yeah.
Yes.
Okay, cool. I'll kick off. So I'm Carl, the co-founder. Hang on a sec. I'll just quickly get my timer. So I'm Carl, the co-founder of Carol. We're a remote monitoring platform for chronic kidney disease. Chronic kidney disease is one of the fastest growing global health problems you actually may not have heard of. Surprisingly, 850 million people around the world have chronic kidney disease. The primary causes being diabetes and high blood pressure. And once you have it, there is no cure. When a patient reaches towards the end stage of chronic kidney disease, they have 2 options: to go on dialysis or have a kidney transplant. I know myself because I've had a kidney transplant in 2012. And the costs are absolutely staggering. Just across Australia, UK, and UK was $130 billion. And there's been a lot of work from Donald Trump in Congress to kind of reverse this, particularly over the past 12 months. Even though CKD can be slowed down with behavior change, it is exponentially growing more and more and more. And by 2040, it is caused to be the 5th leading cause of mortality around the world. One of the core reasons behind this is a broken cycle of kidney care, which kind of leads to an increase in hospital costs and poorer health outcomes. As a patient myself, you live the illness every single day, yet you rarely see your clinician, so you struggle to change your behavior. And on the clinician side, they don't really have the time and the means to manage these mountains of patients, and particularly the high-risk patients, which cost a lot of money. So the real problem we're tackling is that clinicians really struggle to deliver the care that patients need. So meet Carol, the kidney assistant reframing everyday life, a one-stop shop for remote monitoring chronic kidney disease. We've thought about it both sides. On the patient side, we reframe everyday life, a behavior change tool, an app that's live in the App Store, reframing your body, mind, and life with a number of tools embedded. We've also plugged in directly to a predictive tool for clinicians, helping them treat their patients, delivering quality online care, enhancing clinical workflow, and reducing costs. The kidney disease market is massive, but as an early stage startup with only 2 people in our team, we want to focus on where the biggest cost is, which is primarily dialysis, transplant, and end stage patients across our key markets, which are USA, Canada, UK, Australia, and New Zealand. However, you can see where it can grow to with 850 million people across the world. Our core business model is B2B, primarily with hospitals and providers at $10 per patient per month, which gives us a projected revenue of 103 million just with that small primary audience. Our go-to-market beyond that, because we're patient-centered, is a freemium app that offers patients many services, but it also gives us a flow down for additional hospitals we want to speak to. As mentioned, our hospital is a SaaS model, and we also have other revenue streams which we're speaking to at the moment around tech, pharmaceutical, pharmacy, insurance as well. We've made great traction since launching the app stores, and we're active across 30 markets with the app. We have 20 pilot hospitals on board wanting to do trials, and we've actually established partnerships with major pharmaceuticals and other tech companies. Our team is myself. I've lived the experience, and I've got experience with leading consultancies and big brands. And my business partner, who's at 30 years in clinical sales and worked in the NHS, he's based in Australia. I'm based in London. Our mission is to stop people with chronic kidney disease from ever needing a dialysis or a transplant. And we're different because we're co-designed with patients and clinicians and research. Thank you.
Thank you so much for great pitch. Dear judges, let's start Q&A session.
Yeah, I would like to ask, like, why would the hospitals pay for it? Like, did you check what's the reason for paying?
The reason to pay is primarily reducing costs. So the key markets we've gone for primarily are public health. And what we're wanting to do is reduce the costs of high-risk patients. So hospitals pay a lot for end-stage patients, and particularly kidney patients with readmissions into hospital, clinical workflows of unneeded seen patients. So the data helps them get their workflow better, and also kind of at the end of the day gives a better outcome for the patients.
Carl, sorry, are you able to do the health economics on that? Do you have a clinical validation study that justifies how many days of hospital reduction that you're making?
So that's exactly the route that we're going to. And we've got our first trial set up with Monash Hospital in Melbourne, and that's about to kick off, I think, next month. So we've kind of built our products. We've got it in the app stores. We've got a really good cause. And the great thing is across the 20 hospitals that we're talking about, we've seeded that over the last 2 years because we know how slow healthcare can be. So we've seeded that across the UK, Australia, Canada, but primarily it's going to be clinically led research that's going to get us more hospitals.
Yeah, great, thank you. And are you eligible for the Australian export commercialization grants?
100%. So I'm Australian based in London, and my partner on this is an English guy that's based in Australia. So we kind of work both ends of UK and Australia.
Okay, great, thanks.
Carl, fantastic work. I'm curious in the rollout to date, what sort of unobvious and interesting insights have you gleaned from the data?
I think the most interesting insight is that the amount of patients that are reaching out to us that are saying like, oh my God, I need this. It's just like, it's such a big hole in the system that I've lived for kind of 20 years, but knowing that that hasn't been built, and it's not the patient's fault. And it's also not the doctor's fault, as you can see from the cycle, because doctors are focused on mortality. They've got so much to deal with, and patients are just screaming out for help. And they're just like, these small little changes we've built with the MVP has just seen an overwhelming response from patients.
Okay, thank you so much. Any questions out, guys?
Yeah, Carl, hi. Carl, you also mentioned about the fact that, just by monitoring behavioral change, you can end the need for dialysis and transplants. Now, that is a very tall claim. So do you have any empirical data to support that?
I think the mission of the company is so deeply embedded in my life that I wouldn't want anyone else to really go through that in the future. We really put it there as a vision for the team, knowing full well that if we make a dent in 5%, it's going to affect millions of lives. So completely take that on board. It's our vision, maybe 30, 40 years from now, 50 years, that could be accomplished. But I think tomorrow that's going to be very difficult.
All right, thank you.
So much. Next question, please.
Yeah, I just want, because, so great presentation, Carl. I just saw in the map that like there was a project in my region. So if you could elaborate on that, just to see what type of collaboration, or I assume it's a trial.
Yeah, so the hospitals we've seeded are I'm based in London, and obviously with lockdown, I haven't really been able to leave my house too much with a kidney transplant, but we've managed to get hospitals in the markets where we really deeply understand the healthcare ecosystem. So that's UK, Australia, US, Canada, and New Zealand. You might have seen the gray dot on, that's basically patients that have downloaded the app that are interacting. So because we've got a two-sided business model and we're solving two problems, behavior change and clinical trials and research and kind of prediction, I think you might have seen the region of patients that are downloading showing the need to kind of help change their behavior.
Yeah, absolutely. Because I think, this disease is like chronic disease, whether it's kidney, diabetes, are closely interlinked, and
exactly.
This region needs it badly. So yeah, curious to see the development. Best of luck.
Thank you very much, Luisa. Carl, we need to move on. You can continue in chat. And the next one is Samit from Smart Future.
Yeah, hi everyone.
Hi.
Hi.
Just one second. You guys can see my screen, right?
Yes, but my
So my name is Sumit Khimani. I'm from Smart Future. We are a Singapore-based health tech company. As the tagline says, we provide white label telemedicine solutions. The problem that we are trying to solve is actually the current telemedicine itself, how it has been pitched over the last 10 years, how it has been pitched as an Uber of healthcare, as an on-demand convenience in which a big brand will come in and will kind of aggregate all the doctors and then build a network of patients and try to connect the two and make a small margin out of it. We feel that telemedicine should be offered as a technology instead to the existing relationships which already exist for years between a doctor and patient. It should be a continuous care model rather than an on-demand convenience. Again, as you can see how it involves long-term relationship, how it has to be high involvement, how a doctor needs to know about what I have been taking, what problems I have. We talked about chronic conditions in the previous few slides, a few presentations as well, how it's important that existing primary care is offered, not a new business model as such, but within the existing operations and business model, they are given technology of telemedicine. The second problem statement we are trying to solve is telemedicine is FaceTime currently, even though there are a lot of vitals that can be checked remotely, but they're not really integrated into telemedicine. Before a call, the doctor is not able to, check vitals. So that has been talked about a lot over the last 5 years, 10 years, but it's something not being done on a regular basis. So what we provide as a solution is a Wix-like model. When I say Wix, it could be Shopify, it could be Shopmatic, based on where you are, in which we are actually creating, we've automated the whole telemedicine platform development part. So we are able to, create currently many, up to 30, 40 in a month, but eventually, obviously, the goal is to do thousands in a month, creating apps and websites for doctors, primary care doctors, who are then able to, in their own brand, able to get apps which they're able to give to their patients, and they're able to do telemedicine within their existing infrastructure. So it involves integrating with the CMS, EMR system they might be on, integrating with Uber and Grab for the medicine delivery, for example. Even insurance integrations will happen. So based on different markets, there's certain work we need to do in terms of integration, and then we are able to launch. The second problem I mentioned, how we solve that, is by providing home kits, which wirelessly integrate with the apps that we have made for the doctors. So the home kits come in different form factors. Could have one for heart, there's one for lungs, in which before a call or during the call, the patient will be asked to check, and the doctor is able to remotely see the readings. We also provide something for corporate clients, if a doctor or a big hospital might have. So that is pods and kiosks that are installed on site in offices a lot before COVID, but now more in community areas where people can go and talk to doctors. Again, like I said, it's everything from cloud to, to referral letters, to prescription letterheads. Everything is done for the client. So it's actually a standalone APK file, iOS file that is sent, and the doctor has to create their own developer account and create it. The market size for white label currently is at 5 million. Overall telemedicine, as from the reports, is about 41 billion globally. Currently focusing on Asia Pacific, with US as an important market as we go ahead. Business model, doctors pay about $400 to $600 a month. They based on the different modules they pick up, but there's also a recurring fees based on number of calls. They pay between 40 cents in a country like Thailand to up to $2.50 from some small doctors. Slab-wise pricing is their number of calls that are happening. And we manage everything from maintenance, updates, everything for the doctor. The home kits and pods and kiosk on average.
Excuse me for interrupting, but time is over.
Okay, sure. Yeah. So that's more or less about the business model. And I'll just like to show the current traction. So based on that, probably I can take some questions.
Thank you.
So judges, any questions?
Yeah, so that was a pretty good pitch there, and I feel the pain from the sector. There's definitely been a need for this product, for this solution that you provided. Just wondering if you can tell me how quick is the development time for something like this, and how quickly can you scale up?
Pre-COVID, it was about 4 weeks. We recently we were part of the Google acceleration program now, Google for Startups. So they helped us to reduce the Android part of things at least. So we're right now doing it at 2 weeks, including iOS and Android. But simultaneously, we have hired a lot of people. So simultaneously, we're able to do 15 in every 2 weeks. So 15, we take projects and then finish that and then take another 15. So 30 in a month currently, but the plan is to go to thousands eventually with a lot of work that is happening in the back end.
Okay. Good.
Yes, hi, this is Celine. Please correct me if I'm wrong. When you started, you said that there seems to be the current model for telemedicine is a bit flawed. And I see the value that you bring. You are making doctors use their current relationships and strengthening their own infrastructure to make every aspect of the business better. But do you not feel that while you're doing that, doctors can still use the current platforms just as a means of distribution? So yes, you're making them stronger and better, but there is no harm in them also, because everyone's trying to get more patients. So do you not see both?
We have been actually in the market for 5 years. So we've talked to a lot of doctors. I can talk about Singapore and KL in more detail because we have people on the ground. Doctors make a lot of money in this part of the region by selling medicines, so consultation is something they don't make a lot of money from. So the current telemedicine that are prevalent in Singapore, and I believe you are from Singapore, are not sending medicine. So they are more of a marketing tool. A doctor will list themselves, and the patient will find them. So there's about 13 US on average is the cost in Singapore. So they'll make about $10 to $9 on consultation. But medicines are delivered directly by the telemedicine companies. So it's something 90% of doctors in Singapore are not on telemedicine currently. Again, like I say, the reason is they see it as a business model, as a competitive business model rather than technology, which we felt there was a need of. And we started working on it, 2.5 years ago. And again, because of COVID, obviously we've got a lot of traction. A lot of these doctors are already very busy. Some doctors are in 4 clinics in the day. So it's as we sell technology, obviously they don't need more patients. They actually within their existing, they want to see more patients, sell more medicines to more patients. So for that, they have been, inclined to join our platform or allowing us to make platform for them.
Thank you so much.
Thank you.
Yeah, I just have a very quick question in terms of a great presentation, and definitely there's a need. I'm more interested in the home care side of things. The devices that you'll be using, I assume you're not going to manufacture, so you're going to license it to medical devices manufacturers, or how is that going to work? The home kit.
So we have partnerships with Omron, for example. So all their wireless devices. Please note, our background is, my personal background is wireless. So we only use wireless medical devices, so seamlessly we can capture. There are a lot of them in the market. We also do OEM and register them. So for example, Singapore and Malaysia, there were not so many spirometers, for example, we just talked about it. Stethoscope, for example, is a new thing. So we have actually done the HSA and we have done the MDA for some of the devices in our own brand name. Again, it's not something in the long term, but we do see us coming once in a while in some countries like Cambodia, Myanmar, where there's market for it, but we might have to come in and do the registrations in those cases. But in FDA and CE devices, there are a lot. So US being a market we are looking at, we don't find any issue for us getting these SDKs and integrating with our existing platform.
Yeah, especially if you want to capture the data and make it available, digestible for the doctors.
Analytics for doctors is important. So currently the app without analytics for the doctor is a class A, class 1 device. So it's easy to register. But as we start doing analytics for patients and doctors within what we have created, it starts becoming class B and class 2. So which is something we are doing in Singapore, where we are registered as class B, but that is not something as part of what we will do when we enter a market.
All right, thanks.
Thanks, Sumit. Thanks, judges, for great questions.
Thank you.
The fifth startup is Auto-Use from India, if I'm not mistaken. Introduce yourself, please.
Hi, you're able to see my screen?
Yes.
Yeah, hi, this is Bharat Kumar Hegde from Auto-Use, India. I come from a rural part of southern India. A few years back, my mother had some issues with her vision. And then I thought to take her to an eye doctor. But at that moment, I realized that there are no eye doctors in the nearby town. And we have to travel more than 30 miles and spending almost an entire day. So I could clearly see the issues with respect to accessibility and affordability, and the asymptomatic patients are at a huge risk of losing their vision. And there are more than 2 billion such people who are suffering from one or other kind of vision impairment. And interestingly, most of them can be avoided losing their vision if the conditions are detected and addressed at an early stage. So we wanted to come up with a solution addressing the challenges of the existing solutions, that the solution should provide early detection for the case seekers, which should be more accessible and affordable than the current solutions. And it should not have any dependency on a skilled operator or a dedicated infrastructure like an eye hospital or a clinic. And it should enable the care providers to reach the unreached. So that is also a very important thing to have a sustainable and profitable business that we realized. iRobo. So this is the solution we came up with, which is an autonomous system which will provide eye care without requiring any operator, anytime, anywhere. So iRobo takes less than 4 minutes to capture all the necessary clinical information required for the diagnosis of diabetic retinopathy, glaucoma, macular degeneration, cataract, and refractive error. And iRobo is not just one particular device. It's a platform where all part of a end-to-end eye care can be integrated to provide the much better care for the seekers. So this is the kind of disruption we are going to make with iRobo in the urban segment, where the eye care is available at the places which are part of our daily routine. And in the rural segment, a person from my village will be able to get the best available eye care from Bangalore, which is 250 miles away. And iRobo guides the patient with real-time audio commands in the native language. And on the sides, you can see the pictures from our preclinical studies. And the data will be shared with the doctor or a hospital. If they want to have some additional information, then they can remotely connect to the iRobo unit and then capture the required information. So there are many big players in the eye care device domain. But compared to them, like where they have the limitation on the usability because of the dependency, and one has to go through multiple devices to get screen for multiple eye conditions. iRobo is an all-in-one device which can provide the eye care without requiring any operator. And it is more, the market is, our market will be more driven by the care seekers, and also it will help the care providers to make use of that compared to the existing business model of the products which are majorly driven by the care providers. Yeah, this is the kind of disruption in terms of the care delivery and in terms of the business model we are working at, where the care providers will be part of this, and we'll be working both with the care providers and the care seekers to have multiple revenue channels. And we are going to reach more than 100 millions in Asia Pacific region in next 5 years, and it will help to save us the vision of more than 1 million by 2026. iRobo will reduce the cost of eye care by 1/10 of the existing, and it will help the care providers to reach much higher population. And it will be a great employment opportunity for the young men and women who have minimal qualification. We are a passionate team who come with relevant background and experience, which will make the iRobo a successful product. And we started just a year back, and it has been a great journey. And I would like to welcome you all to join us, making the world a better place by stopping avoidable blindness. So our effort has been recognized by many national and international platforms.
Thank you very much.
Yeah. Thank you very much.
Thank you. So, dear judges, let's start Q&A. Any questions?
Yeah, hi Bharat. Hi Bharat. I would love to know the price point of these iRobos that you're making.
It will be around 5 lakh rupees. For the customers, okay. And there will be more. It's the one time the non-recurring expenses, and also there will be a revenue sharing with respect to. So basically, for hospital from business point of view, it will be a kind of a patient capture. Like for the patients, it is the early detection which will help to reduce their disease burden. For hospitals, they are reaching the people who are asymptomatic and engaging them at an early stage. So there will be a long-term engagement with the patients. So in terms of USD, it will be around 7,000 US dollars.
Okay. Thank you so much. Any questions else?
Yeah, that is actually half of what the cost of all the device required for providing the same service. And that comes with no recurring expenses of operator or a professional.
Yeah, this is great work. Can you go a little bit more detail on how you compare against, say, Remedio, given that you're in the same country, in the same space, and they're also now advertising the potential for a pharmacy kiosk? And I do know that their cost is also quite competitive.
Yeah, so so here we are providing all the technology which can provide the clinical information for most of the causes of preventable blindness. So we are having the fundus imaging, the anterior imaging, and the refractive error measurement all in one, and the technology has been protected by registration. The India patent and the PCT registration.
Okay, thank you.
And like the smart future, we can collaborate with such telemedicine and those people and platforms to make it more attractive. And also for in the COVID-19 kind of a situation, it becomes much more relevant with minimal human intervention.
Okay, thanks so much. Any questions?
I have 2 quick questions. One
yes.
Yes, please.
Yeah, just if I may, like, do you have any data to provide the accuracy of the machine versus like a typical consultation at?
Yeah, we have compared the performance of a skilled operator with respect to the performance from our machine. Is that what you are looking at? Yeah, so it is it is comparing 92%. And one another thing is that with the operator, there will be operator variability if the device is used by multiple operators. And for example, in the age of AI and ML, the proper and consistent data is very important to come up with some accurate models. So there we are avoiding the operator variability and also the device variability. So the device has specific thresholds where it will capture the images or the measurements. So it will be more consistent. That will help us to come up with accurate AI models.
Thank you very much. Great pitch. Let's move on. We crossed the equator of our competition, so it's only 5 startups left. And the 6th one is
one message came from my side. Dear judges, don't forget please to vote for our startups today. It's very important. Thank you so much. Now let's continue.
I'm sorry, am I next? Some kind of network issues. Hey guys, this is Saurabh, CEO of Endovision. Hope you're having a great time. Let me share my screen. All right. But, can you see this?
Yeah.
Right, great. So, a second. Yeah. All right. So basically, we are a quality monitoring system for upper GI endoscopy, and we use AI to reduce the blind spots. So as a quick summary, we are a seed stage funded startup. Our product has already been built. We are based out of Hong Kong, and we are in advanced talks with Olympus for distribution, which by the way holds 70% of the endoscopy market share. So gastric cancer is a huge problem in East Asia, where the incidence rates are 10 times higher as compared to the Western counterparts. Endoscopy is the gold standard for early detection, but 10% of the patients get missed even after they go through the endoscopy. The question is, why do the doctors miss? So the upper GI tract has a very elusive structure, which makes it very hard for the doctors to cover all the blind spots. So here's a quick demo of our solution. So on the left-hand side, you can see the real-time video feed. And on the right-hand side, you can see that all the blind spots, sorry. So on the right-hand side, you can see in the thumbnails that all the blind spots have been tracked. So the goal of the doctors is to make sure that they have seen all these areas. And in addition to that, what we are doing is we are also calculating the time spent at each of the landmarks. And we are also generating the photo documentation autonomously. So it saves the doctors the time to take all these pictures. So here's how it is used in clinical practice. In terms of competition, there's a lot of interest in AI for endoscopy, but our niche is AI technique improvement in upper GI, which is not competitive. We have an exclusive IP arrangement with the Chinese University of Hong Kong, and we are backed by Hong Kong Science Park, which is a government Hong Kong government aided grant. The next product pipeline is automating the report writing. We have a world-class team of clinicians, which also includes Professor Ken Xiao, who has invented the screening protocol that we all are discussing here today. The founding team has varied backgrounds in business, medical, and technology. The future of endoscopy is going to be autonomous, and we have already taught the our AI about the anatomical understanding. So, which is the founding stone, which is like the basis, for artificial general intelligence in the field of endoscopy. So that's it from me. And
okay, thank you so much for great pitch. So, dear judges, let's start Q&A.
Yeah, hi. I would love to ask, like, you mentioned that it would save the time for the doctors. So how would that be? Because from what I've understood from speaking to the doctors is that, like, they really don't like the use of like capsule endoscopy and all, because it asks like to see each and every corner of the stomach and all of that. When the doctor immediately after seeing the snapshot, he knows that it's a like physiological, like there's nothing wrong with the patient. So even in such cases, like if we go through like AI and all, like that's the problem that the doctors face. So what's your opinion about that, and how does it save the time?
Yeah, actually, that's a great question, and that's one of the future prospective studies that we are aiming to prove. So, to answer the first question, there's some kind of learning curve. So, for the expert doctors, it doesn't take much time. But let's say if you, for a trainee, if you suddenly put an AI, there is some kind of learning curve. So, yes, there is an increase initially. When you ask them to see all those blind spots. So, in the beginning, there is an increase in the inspection timing, and gradually, as let's say within 2 they get more used to this, and then their timing also goes down. So that's one thing. Secondly, it directly saves the photo documentation time. So right now, at least in the Eastern Asian countries, they're following the systematic screening. So for that, they have to stop at each and every location taking those pictures. So we are like asking them not to do that. We'll autonomously populate that report. So on the reporting side, we are saving a lot of time, not on the procedure side.
Okay, thank you so much. Any questions?
I just wanted to ask one question, if that is okay with you, Elena.
Sure.
Yeah. Hi, Saurabh. This is Brady. I just want to ask you, liver cirrhosis is one of the greatest problems the medical fraternity face, right? And it is handled by endoscopy. Does your solution kind of, capture it and eventually provide some solution?
Well, that's yeah. There are actually plenty of requests coming. Already started to come to us. So the liver cirrhosis kind of it's the endoscopic EUS site, which there are some future applications towards this. But to be very honest, like we want to stay focused towards like more on the diagnostic side of upper GI, because things are pretty competitive. So we're planning to build like incrementally, like more like starting from like improving the accuracy to going more deeper into the reporting and the ICT applications.
Got it. Thanks.
Okay, thank you so much. Any questions else?
We have time for one question.
Yes, please.
So a good presentation. I wanted to find out, you mentioned that 10% of gastric cancer cases are missed. Now, have you checked with your technology, whether this 10% has come down to zero or at what levels essentially? And what is the accuracy at which you detect?
Yeah, that's a great question, Shailesh. And so actually, so far we have done clinical validation of our software. So the goal of our prospective study is to do a double-blinded study. In this, we will be able to prove this. But we have already, like as part of the clinical validation, we have already seen that there are plenty of spots being missed. So it's almost like a trivial outcome from the blind, like it's going to be the primary outcome, but we already know that if you put that, that thing in the hospital, doctors always tend to cover all those areas once you show them. So it is going to be proven as part of the prospective study. So the study is going to start in January 2021. I mean, which is basically just to add like more credibility, but it's not stopping our commercialization. Like we've already going ahead with the commercialization.
Okay, thank you so much, guys.
Can I ask one question, please? On the commercial side of things, can you just talk me through the strategic partnership that you have?
Yeah, I mean, at this point, I mean, we can disclose that we are Olympus, which is like the market leader for endoscopy, and I mean, yeah, we're in terms like there are certain things which needs some kind of NDA to have further details disclosed. Happy to connect afterwards and speak in details.
Okay, thank you so much, guys. Let's continue. So next one is Valgen. Yes, please.
Hello.
Hello.
Hi, let me operate. Okay. Oops. Sorry. Can you guys
Introduce
hear me?
yourself.
Can you guys hear me?
Yeah, we are here.
Okay. Hi, my name is Ethan. I'm the founder and CEO of Wellgen Medical from Taiwan. There's a huge market in medicine, but still very labor intensive, which is microscopic. You need to have a doctor sit in front of the microscope to detect the disease. This method has been used for more than 100 years. And actually, it's a huge market. It's $1 billion business. For tuberculosis only, it will hit 3 billion by 2024. And for pathology market, it's also $1 billion market. So, but this method has a problem, has a low detection sensitivity in tuberculosis. As you can see, the detection sensitivity are very low. And in pathology, in this shocking study, you'll see 40 pap smears given to 19 observers. Actually, only 4 reach the same results, and 12 slides have 4 to 5 different diagnoses. And also there's importance about the microscope itself. This is a study from US by Nature. You will find out that there could be more than as much as 20% differences on the accuracy if you use different microscope. Wellgen developed a hardware and software to solve this problem. We have our own design of a microscope. It's an 8-slide system. It's a fully operated from the cloud. You can control and connect it through internet. And we have done many clinical data on tuberculosis detections. We already sold system in Taiwan and Japan. And the same system can also read many other slides, other pathology slides. So we have 2 big competitors, Philips and Leica. They are all very good. They are 300 and 400 slide auto changer. So consider they are a big bus, and we are actually developing a minivan. So we want every doctor to have the digital pathology, because based on this email that my colleague corresponding with, more than 90% of the hospitals in the world are small hospitals. They cannot afford the big systems. So we want to get US FDA first, and we want to work with Philips and Leica, so we will cover all the surrounding small hospitals. Also, we want to work with CRO, so the CRO can run the clinical trial faster without sending the slides back to the central lab. And we can also work for the AI softwares where they can develop their software based on us. I used to be a college professor from US, and this is our timeline, and we're actually looking for A-round funding for 1.3 million for this. We are expecting to break even in early 2022. Thank you very much.
Thank you. Thank you so much. Any questions, guys? Yes, please. Dear judges.
They're still like digesting. I'm speaking too fast. Sorry about that.
It's okay. It's good.
Sorry, this is a great model. Just a quick question. What is your, just look at the timelines. When will you be able to commercialize your product fully?
This product is already commercialized in Taiwan and Japan. We are getting the China FDA and also the US FDA. If we want to go to the pathologist market, we already have a distributor in India to promote for tuberculosis. So our core competence is one hardware is this microscope, automatic microscope. One software is the tuberculosis. And we like to add on more softwares on pathology, which is like an app add on to our platform. So we want to open our microscope platform to other AI software companies so they can work on their recognition pathology system over.
Okay. Good stuff.
Okay, thank you so much.
I have a question.
And since you spoke about distribution in India, there's a company called Sigtuple based in Bangalore, which is pretty well funded in this space. And their journey has been nothing short of a roller coaster ride. And one of the reasons is because, I mean, especially if you look at this entire space of cancer histopathology, the slides prepared in this part of the country are pretty poor in quality. One, because the training is pretty poor for the technicians preparing, and also the instruments that they use are mostly refurbished or might not be the best in the medical grade. So how do you ensure that the image that you're capturing of some of these slides are good enough for pathologist review? Do you have some kind of that you have built to ensure you have good images?
Yes, there are three important components. One is the making the slide. Two is the microscope. Number three is the software, okay? Every software company struggle on the first two problems. We solve the microscope problems. So if the slide is prepared badly, so not even human can read it correctly anyway. So I think this is a time for country, for people to make the slide correctly. And we will come in to solve the second problem is the hardware. We will have a standardized microscope platform so the softwares can work based on our system. So again, if the slide is prepared badly, even doctor, even human cannot read it anyway. So we have no way. So I think it has to go through the education. We also have a special slide that to tell them exactly to put the slide, to put the specimen on the exact place. So that will be my answer to you.
Interesting. Thank you.
Thank you.
Thank you so much. Any questions else? Okay, let's continue. Great.
Yes, the next one is Orbit Health, represented by Patty. Patty, please unmute yourself.
Yep. Can you hear me and can you see the screen?
Yes.
Great. Hi, everybody. I'm very happy to be here to present to you about Orbit. My name is Patty. Orbit is a device-agnostic AI solution that enables, for the first time, physicians to personalize treatment for Parkinson's disease patients. We are an amazing team bringing together decades-long industry, clinical, and data science experience to ensure the success of the company. We don't just understand technology, but we also understand the complex healthcare environments that we operate in. What problem are we trying to solve? Almost all Parkinson's disease patients have to experience treatment-induced side effects, and that causes them to fluctuate between two states. One is a hypoactive state characterized by stiffness and immobility, and the other state is hyperactive states, which is categorized by abnormal, uncontrollable movements. These two states fluctuate many times during the day, and it's very devastating for the patient and the caregivers. And because of this, there's increased care cost due to increased hospitalization and dependency. Now, there is a way to help these patients, which is to regularly tailor the treatment regime for them based on what drugs to take, how much to take, and when to take it. However, doctors can't do that effectively today because they're relying on a snapshot of information that they gather only at doctor's visit. When the patient goes home, the doctor has no clue how the patient is doing or responding to the treatment, and therefore they can't really personalize the treatment for them. To meet this unmet medical need, we have developed a device-agnostic AI solution that relies only on a single wrist-worn sensor like a Fitbit watch or an Apple Watch that processes passively, that captures passively motion data, which allows for our AI solutions to process. Now with this, we can now provide doctor with continuous objective symptom report, and doctor can see how the patient's actually responding to every medication that's being taken so they can tailor the treatment to obtain maximum symptom control. It comes with the patient and caregivers interface, as well as the doctor's interface. But what we are building as well in the back end is a back end that allows for collaborations with other digital tools and other healthcare professionals to look after the comorbidities. 7 clinical trials has been conducted to validate the relevance of our solution. And we got data from, we meticulously label minute by minute, 20,000 minutes of data from 300 patients. We've done UX UI research, and our studies have been published in over 20 international publications, including Nature Scientific Reports. In one of the clinical studies, you can see that the doctor is able to help the patient to maintain optimal symptom control for over 80% of the time using our solution compared to 60% without. Asking the patients, they all love the solution and wear it every day. And then the doctors basically labeled us as a game changer and say they've been waiting for our solution for a long time. With this, our target is really to look into the physicians and hospital clinics market. We'll be charging a yearly subscription of close to about $3 a day. With this, we're already looking at, just looking at the early adopter market, over 800 million of market potential. Thank you very much, and we look forward to your question.
Okay, thank you so much for great speech. Dear judges.
Where are you based now? Because I see German accelerator in your presentation.
Yes, so I'm in Singapore and my co-founder is in Germany, in Munich. A lot of work has been done with LMU in Munich. My co-founder used to be a Parkinson's disease doctor.
Okay, thank you.
Okay. Any questions, else, guys?
Yeah, this is Vikram from GHP. My question for the Orbit is like, what kind of patents you have if you have filed? And which territory is it for? Patents.
We have it's the AI solution, so we own the data. We purposely do not go after IP, but we categorize that as trade secret.
Okay. And the venture is registered in Singapore or Germany?
The headquarters in Germany, and we have an entity in Singapore.
Okay, thank you.
Hi, I have a question here. Patty, is it? Yes, I'd like to know how long you've been involved in these projects and also how much have been invested in the project.
So it's been bootstrapped so far. We started the research in 2016, and then now we're ready to actually commercialize it. So we are at a stage where we've already got a solution for the doctor, and then pursuing CE mark filing and DIGA registration.
Okay, so you're seeking for how much for this round?
Can I say this here? Yeah, so I'm seeking for 2 million.
2 million.
Round. Yeah.
Okay. Okay, this is for the tech development or for the marketing? Or for?
This is for so there's staffing, and then also for the multi-center intervention trial, and for CE mark filing, HSA filing, and DIGA listing.
I see, because I realized in this event, most of the techs are using AI now, you know, so yeah, seems like everybody's using AI. Okay,
yeah,
thank you.
We've actually, yeah, I can communicate with you later, because we did like a very unique thing when it comes to clinical labeling to make it relevant.
Yeah, okay, thanks.
Patty, hi, this is Eric from Singapore. You mentioned you're also pursuing HSA certification. In what aspect of HSA certification you're
Class 2.
Class 2 for medical devices?
Yes, yes, because we process the data and we actually analyze the data to give symptom insights for for personalizing the treatment. Yeah.
Okay, and second question is addressing Parkinson, which countries are your maybe top 5 countries that you reckon that will be heavily applied to in terms of the usage?
So in terms, if you look at the patient population, obviously US, China have a lot of Parkinson's disease patients there, and then also the big 5 EU countries like Germany, Italy, UK, France, and Spain. Okay. But then in this case, we're also looking into the private sector versus the public sector. So there's quite a lot of demand from the private sector, where it's actually a patient pay model or a private insurance coverage model, which happens to be a lot in Asia Pacific. Yeah.
Okay. And is that why the HSA certification that you're...
Yes. So that is actually one of the beachheads. We've identified Hong Kong and Singapore to be our markets to target for next year while we're doing the actual registration for CE mark. Because for Singapore, we need the ISO and then we can go for HSA. For Hong Kong, we actually don't need to have the regulatory approval. We just need to have clinical claims.
Okay. Thank you.
Thank you so much. So, okay, let's continue.
Yeah, we need to move on. And the next one is PhysioQ. Simon, are you ready?
Can you see my screen?
Yes.
Yeah.
Okay, so my name is Simon, and our company is located in Silicon Valley to San Jose, California. We are consideration of the hypertension and headache and migraine device. So we have a device section, and also we have a health monitoring section for this monitoring mobile app section. You know, hypertension is a global issue. Typically, Russia, Brazil, they have more than 40% of population as hypertension. Typically, in this Russia, even Europe and then Asia, they have more than 35% population is hypertension. But still, medicine is a side effect, so people looking for another solution. So we have a solution. So device is just, we need to find the ROE, turn on the device, put the ROE the 5 minutes, you can see this result. So even though one African American lady, her initial blood pressure is 149 to 95, just 5 minutes using the device, her blood pressure dropped to the 120 to the 87. We can decrease the systolic, but we also can decrease the diastolic together, at least the 15 millimeter mercury drop down. So we have done to this initial clinical trial for 60 patients. So these 60 patients never take a medication. Every day using the device for the 68 days, 87% is people to decrease the blood pressure drop down. So we have 30, 40, 50, 60 years old people, and then men and women is the same, but it's a 15 millimeter mercury drop down, the blood pressure drop down. Even though we are tested with medication, and then but we have another additional benefit. We can decrease the blood pressure drop down more. So later medical doctor to ask them to reduce the blood pressure medication. So we also have a biosensor. So it's whenever hold the device, and we can check the blood pressure from your finger, send the data to cloud base, so we can show them to the daily, weekly, monthly, and up to 6 months data. Of course, we have a competitor, but it's not many competitors because other competitors are very expensive, but not the user-friendly device. So we have a much better benefit to them. Our team is pretty much an industrial expert team, and then also all the team has also investor experience team. Even me, this is my 6th company. I sold 2 companies already. Even we have a Stanford medical doctor to UCSF medical doctor to supporting this project. Up to today, we got the $3.5 million fund from the multinational, and also we are working with the US hospital to Saudi Arabia hospital. Our company is called to the within 5 years, we sell the company to the big pharma or medical device company. Now our company is looking for the $7 million fund for the Series A fundraising, and they're using this one to the supporting to the more project. So we have a device, and then we also have a Chinese version. And then even if this is a Corona time 2020, we just pitched to some event, and then we got the best project award. So thank you so much.
Okay, thank you for great pitch. So, judges?
So when you say it's a Chinese version, do you mean you manufacture out of China, or it's for Chinese market?
Yeah, we are targeting for the Chinese market. That's what it is. We have a Chinese version. So we manufacture this one in this key component in the Vietnam, and then we assemble in the Shenzhen to supply to the potential Chinese partner now.
Okay. And can you also walk us through your business model? How do you plan to generate revenue?
Yeah, business model is we want to B2B business because even though each country, we don't know exactly their culture. That's the reason is we are looking for the strategic partner for the local partner. So we try to sell through this device through this local partner.
Okay, thank you.
Okay, thank you so much. Any other questions?
How much is one device?
This device is a $299.
$299. Okay.
Yes.
And it's available in all clinics or?
That's what Yes, so that's what is this device come out 4 months ago. So this one is a FDA class 1 device now. So that's what is we are looking for this $7 million for this supporting to this FDA class 2 device, a 510K device.
I see. Okay, thank you.
Hi, Simon.
Could you please explain the technology behind this in terms of, let's say, for example, you rub this on your temple and you say within 5 minutes the migraine disappears.
Yes,
so
this one is a technology. Technology is behind for this baroreceptor stimulation. So in the human's body has this left light is artery plus the nearby this hot as there is a controlled blood flowing. So whenever just we using this thermal neurostimulation is a cold temperature with the micro vibration to the stimulation to baroreceptor. So signal going to your brain. So brain nervous system to control your parasympathetic nervous system to reduce the blood drop down and then making the balance to your human's body. Kind of just the yoga and then exercise for the everyday. You can just not only reduce the weight, but it's also to control to your body to rebalance up. That's the baroreceptor stimulation technology to beside this mechanism.
Yeah. How long does the baroreceptor stimulation last for?
There is a depends on the people. That's what I show you is, but initially is whenever you're using is up to 1 to 6 hours to on hold down. But interesting is every day using the 5 minute to stimulation, this hour is longer and longer. That's the reason is whenever we done to the clinical trial, and then so 10 to 15 days later, it already covered for the 24 hour. So every day using is more than 24 hours cover down, drop down.
Oh, that's fascinating, and no habituation.
That's what I just this is not the miracle device and the magic device, but is a background is for the baroreceptor stimulation, and then that's what I just even though some of this competitor already existing to the baroreceptor stimulation to this device, and they reduce the proportion drop down or just even this headache and migraine. But is other device is electrical stimulation, but we are using this thermal and then also micro vibration the stimulation device.
Great. Thank you.
Okay, thank you so much. And before we will continue till our last startup for today, but not the least, dear judges, don't forget, please, to vote for our participants today. It's very important.
Thank you, Simon. And the next one, the last startup, Naluri.
Hey guys, just checking.
Represented by Aida.
Hey guys, just testing that you can hear me well.
Yes.
Perfect. Thanks, guys. My name is Aidan. I am the Chief Commercial Officer of Naluri. We are a digital therapeutics company that helps people manage their chronic disease risk and improve our mental health of our members. So long before global pandemics dominated health headlines, there existed another silent pandemic claiming tens of millions of lives a year. Non-communicable diseases such as cardiovascular disease and diabetes affect over 1 billion individuals in Asia, causing an economic burden of over $100 billion US. Now, coupled with medical inflation rates that are among the highest in the world, there now exists tremendous irony for insurers and employers who are paying more and more every year for care, yet people are getting sicker and sicker. While the existing healthcare model is effective at treating acute conditions, it is extremely ineffective at treating chronic conditions, which require long-term structured care. The existing healthcare model suffers from 3 key shortcomings. First, it is reactive and transactional, where patients seek care only really when they are sick. Secondly, increased specialization in the healthcare ecosystem means chronic disease patients typically do not get the multidisciplinary care that they really require. And thirdly, wellness programs tend to focus on activities rather than quantifiable health outcomes. Now, while the shift to telemedicine solves issues related to accessibility, it still does not solve these 3 key issues. At Naluri, we believe the future of chronic care management is a world where there is proactive and long-term structured care for patients that integrates both physical and mental health and focuses on outcomes instead of activities. It's been shown that holistic lifestyle modification, and it's been proven that these things are extremely effective, but it's typically very, very expensive. Naluri solves this by digitizing the entire process to make chronic disease care as affordable as ever.
Nullery greatly improves the productivity of health coaches by shifting conversations to asynchronous text-based chat to allow coaches to serve 10 times the number of patients than before. Furthermore, the proprietary Nullery brain augments the coaching effectiveness of coaches by using machine learning to personalize their coaching at scale. The Nullery program has been shown to be effective at improving health outcomes both in physical and mental health markers, which reduce chronic disease risk and healthcare expenditure over the long term. And with this data, corporates and insurers are finally able to quantify health expenditure savings and reprice their risk. We started in Malaysia 2 years ago and have quickly expanded to Singapore and Indonesia, where we have partnered with the largest corporates, insurers, and pharmaceutical companies and healthcare providers. Having recently hit our $1 million ARR milestone, we expect to continue growing 3 to 4 times year on year. We've assembled an incredibly experienced team who have built and IPO'd companies in the past, worked for the top consulting firms in the world such as McKinsey & Company, and who have deep experience in healthcare, psychology, and tech. Here at Nullery, we have really ambitious plans, and over the next year, our key goals are to, number 1, further validate the efficacy of the Nullery program through clinical trials. Number 2, build strategic partnerships with companies and expand geographically. And 3, continue investing in the Nullery brain to further strengthen our IP. But most important of all is us staying true to our core goal, to help people achieve their healthiest and best selves. Thank you.
Okay, thank you so much for great pitch. Let's start Q&A. Yes, please, guys. Who would like to be the first one?
Can you repeat, please, and tell us about source of your revenue, please?
Yeah, so we're predominantly a B2B company. So we work with 4 key types of groups of people. The first is corporates. And what we do with them is we basically help them manage their healthcare cost expenditures, which is escalating in this region between 10 to 15% year on year, and improve productivity of their employees. We work with insurers, and we basically we help keep their policyholders healthy and therefore reduce their claims ratio. We work with pharmaceutical companies to augment the effectiveness of their medication. And finally, we work with healthcare providers to close the loop of care and provide healthcare out of hospital or post-hospitalization. So it's normally a subscription per member per program.
As I understand, you have more than 1 million in revenue, yeah, for the last year.
Yeah, so we just hit $1 million annual run rate. Over the past annual year, we're at about $800,000, but at the moment we have an ARR of about $1 million.
Okay, and geographically, your revenue from which countries?
So we're based in Kuala Lumpur in Malaysia right now, and we have a geographical presence in Malaysia, Singapore, and Indonesia. And we have plans to expand to the Philippines and Thailand very soon, as well as Australia and potentially Japan.
Okay, thank you.
This is Vikram from GHV. What's your LTV for the customers? Lifetime value of your customers?
Yeah, so typically our customers are between $100 and $200 per program. And basically we see them kind of graduate the program after a period of about 4 months to a year. And the idea is most of our members typically graduate the program. And so we typically have a fairly high success rate. So we don't see them having reliance on the program for kind of a long period of time. We typically graduate them on after a period of about 4 to 6 months.
And what's the CAC?
Pardon, the customer acquisition cost?
Yes.
It's roughly about 1/3 at the moment of our revenue.
Okay, thank you.
Okay, thank you so much. Any other questions?
Yeah, just a very quick one. What's the drop rate of the people you onboard on the coaching? Because that's usually the problem.
Absolutely. So the reality is not everyone graduates from the Nullery program. After a period of about kind of 4 to 6 months, we see about 70% of the individuals achieve what we call a clinically significant outcome. And of course, we're trying to push that higher, but the reality is, I don't think it'll ever be 100%. At the moment, that kind of 60 to 70% success rate is a figure that our corporate partners are particularly happy with at the moment. So we'll try to get that up, but so far so good.
And for the coaches that you onboard, are they like employees of Nullery or consulting?
Absolutely. So this is incredibly important, right? Because we're not a telemedicine company or platform. The coaches that we have are full-time Nullery employees, and they're trained in kind of how to provide long-term digital care. the idea is to ensure that they kind of build a relationship with the user or the member, and not have a transactional conversation with them kind of once in a while, like we see typically with telemedicine platforms.
And lastly, like, do you envision like expanding to other areas, to other diseases, like to apply this model?
Absolutely. So I think probably the next couple of areas, and we focus on chronic disease, so hypertension, diabetes, hyperlipidemia, et cetera, as well as mental health, very importantly. But we do foresee us kind of going down different clinical pathways, such as oncology, pretty soon.
All right, thanks.
And what is your future plan in terms of exit? Are you looking at an IPO, an acquisition?
So the likelihood is we're thinking that probably an acquisition is more likely than anything. We see probably two potential exit routes. One would be, for example, through an insurer, where we can basically be bundled with their products, making sure that we keep the policyholders healthy, therefore kind of reducing the risk of payout. And potentially a second other exit would be through the pharma route, where we can be bundled with some of their medication to kind of augment the effectiveness through improved medical compliance, medicine compliance.
And languages, do you have any different, like how many languages are you able to communicate with? And
yeah, so also very important, like every country that we're in, it's hyper localized. So Malaysia, for example, we do English, Bahasa Malaysia, and Mandarin. In Indonesia, for example, we have Bahasa Indonesia. And part of why we haven't yet entered certain countries like Thailand is because we're taking the time to kind of ensure that we build the correct coaching base who can speak the local language, because that's incredibly important. So it would be localized to each individual country.
Right.
Thank you very much.
Thank you.
It was great. Yeah, it was.
May I also ask?
Oh,
yeah. Okay.
So maybe I missed the amount of money that you would like to raise. Can you clarify
sorry,
that?
we are broadcasting in many countries. We're raising questions in some countries are prohibited. So please ask those questions in chat. You're able to chat with every participant.
Happy to take this offline.
Yes, you can say it out loud. Yeah, thank you for evaluating that. Yes, dear judges, we have 1 minute for you to finish voting if you would like, and girls will be closing our votes. Am I right, girls?
Yeah.
Okay,
exactly.
So in 1 minute, we will know who will be joining us for the finals, and hopefully those finals will be in Silicon Valley.
And I would like to add that today's winner will be invited to our VC house meeting. It's a closed meeting where only VC will be, and so it will be 1 hour meeting, and we can talk more with the winner of today's battle, and so VC can exchange thoughts about this startup, and maybe someone decide to invest in it. But yeah, it's a good idea. So if you are a VC and you are still not in our club, in our VC house club, we invite you. There is Natalie probably with us today, and she can assist you with application. And so we usually have great startups in this really closed community. So
yeah, that's a wonderful opportunity for a startup to really be visible and interact with the top VCs, right, from all over the world. Really, really great idea. And Natalie will publish a link in the chat, of course, and you will be able to see it. Okay, girls.
Okay, we are ready.
Oh, we have a winner already. Okay, so
exactly.
Can we know who had won the 3rd place?
Yes, 3rd place today goes to Carol.
Carol, okay. Carol,
congratulations.
Well done.
Applause, guys.
Thank you, guys. Thank you.
Okay, congratulations. So it's time to know the 2nd place is go to Orbit Health.
Orbit Health. Yeah,
Thank you.
Congratulations.
Thank you.
Hey.
Oh, the winner of today's Healthtech Unicorn Battle in Asia is Naluri.
Oh my God. Yes, how wonderful.
Thanks so much, guys. Really appreciate that.
Yes, get ready to go to the Silicon Valley. Yes, I'm saying that we all, of course, would love to welcome everyone in the Silicon Valley where our headquarters are, but just in case the restrictions remain in place, we will be hosting everyone online, which is also good because we can expand our auditorium to many, many thousands of people. But get ready for the finals. You will be presenting Healthtech Asia.
Awesome. Thank you so much, guys. Really appreciate it.
Yeah, really wonderful. Now we have a couple minutes to go for the networking session. Alexander, is there anything you want to know from the VCs in the fall season?
Yeah, let's just talk a little bit about what's happening in Asia, in health tech in Asia. So I did not heard about coronavirus startups today, which fight coronavirus. So it's no more the problem. Who knows? who can comment from Asian VCs?
Maybe all startups that are fighting coronavirus already unicorns, and they don't need any more money. They're already funded.
In spring, we had coronavirus battle in Asia. There were a lot of startups really.
Yeah, maybe Alexander, I can chime in. I can only speak from a medtech perspective and digital health side. We actually have a huge demand across our audience, of course, on the COVID side. But for many of the founders who took a pivot to COVID and left their core business to one side, I think for some of them that's been a great disadvantage and almost a detractant. One example is a company looking at non-small cell lung detection through breath has moved over to COVID, and we think they actually left the pot of gold behind. So, you know, there's been quite a lot of pivots to the area of COVID. And similarly, you have to start again from the regulatory side. And while we've seen accelerated FDA and TGA pathways and even accelerated CE pathways on the digital therapeutics, you know, it still requires capital, it still requires time, and it still requires a significant concerted effort specifically just focused on COVID. On the medtech side, we've seen those that actually own their value chain and had access to a master distributor still going strong, right? But if you were having to sell to a hospital for the first time, then clearly this is not your time. So many of our founders have focused on those markets that need it most, especially in the US. But it's also been a very difficult mental health time for our founders. We've lived through this period where our founders literally calculate how many of them are likely to die in New York City by the end of the quarter because their doctor's in a hospital, right? So I think it's been a difficult time on the business side. It's been a challenging time on the mental health side. And most importantly, for those that are making progress, champions like Naluri, like Miracle Health, like Orbit, and like Longenesis, these guys have stayed true to their core. They've taken advantage of the opportunistic upside, but they haven't forgotten about their core. And I think this is an exciting time for those guys, particularly as they go out to raise funding.
Thank you, Lisa. Yes, that's wonderful recipe to follow. Yes, Pradeep.
So Alex, my input from India side is that one is that there are cases increasing, but at the same time, I think people have this urge now to go out and interact and do business. So I think if there is an innovation on how to prevent COVID or to eliminate COVID when you are interacting, especially in closed rooms, etc., that is some startup or an idea which we are also looking for, and we would probably partner, invest in that kind of a company, because we are building a portfolio of hygiene products for India, starting with a sanitizer which can work without contact, a vegetable cleaner, a UV box which can disinfect material surfaces, etc. But more importantly, and which is the most big risk, is that how within closed space, airborne viruses, especially the COVID spread through speaking, talking, we can eliminate or prevent. If there are solutions around this, they are welcome, and we would surely want to partner with those kind of startups and ideas. We're already working with a couple of them. They are not on this panel or in this startup discussion, but we are already seeing that some startups are working in this area.
Wonderful. We will be having Healthtech Europe, Healthtech North America, and Healthtech South America further on in the fall. And so we would, of course, welcome all the judges to join us for all our upcoming battles further.
Okay.
Yes, Alexander, I interrupted you. You were about to say something.
I don't know. Maybe someone has a great story about Asian health tech startup and can tell to the community today. And so maybe it's really wonderful story. I don't know.
But has anything drastically changed from spring to the fall? Has it become easier to interact with the startups?
I might give maybe the perspective of Middle East, since I am based here in the UAE, and it is very telling, like the comment of Alexander about why no COVID startups. I tend to think of the startups today as somehow related to COVID because they address a different issue, which is non-existent in my markets. For example, telemedicine, remote care, taking care of patients inside their homes and making them stay at home and making sure they stay healthy, diabetic patients, people with chronic diseases. And it's quite interesting to see there's going to be a rise in the region with all these services. For example, telemedicine wasn't allowed pre-COVID in the region, and they had to change the regulations in a couple of weeks. And then when we went to the hospitals and corporate partners we work with here, they didn't really want urgent solutions for COVID, but they wanted solutions for their existing patients that they wanted to protect. So I think COVID has disrupted healthcare in various areas. And I think this is the take that I have on my particular zone.
Yeah, thank you, Luisa. Thank you.
Okay.
Maybe some VC can tell us the story of investing in a health tech startup this year. Is anybody already invested?
Yeah, I guess I could share a couple of stories. I mean, we were lucky in that the founders, I mean, there's two issues here. Number one is, are you investing at all? Number two is, how do you invest in people you've not met? And the second one, I'm not sure I can answer that one. I have an idea on how to start doing it. But on the first case, we did invest in a couple of companies this year, and we're actually probably going to do another 2 deals in the next 2 months. But we've known the founders beforehand, and it's just a matter of they're now at a point where they're ready to be invested. And a lot of the personal due diligence was done before COVID hit. With the latter case, this is something that, you know, is going to be interesting, quite challenging, in that if you're investing at an early stage, you are investing in people, you're investing in teams, you're not really investing in a product that doesn't really exist yet. So how do you do that in a place where you can't meet face to face and really judge the character? How do you do that? So, you know, it is about building trust, and we're trying to figure out different ways to build trust. And part of this is trust by doing. So one of the things that we started to do is to see if portfolio companies could work with a prospective investee, and the feedback from that experience, this concept of try before you buy, might be something that could serve as a proxy, because you're diversifying the points of view in terms of assessing, you know, the character and the values of this startup. So that could be one way to do it. In terms of the climate, it's kind of funny. COVID has let the developed world know what we've been facing. I'm based in Singapore. You know, there are 680 million people around me that have pretty bad healthcare. A lot of them are very, very far away from a doctor or hospital and don't have the affordability to see it. And what COVID has done is it has basically made healthcare inaccessible for everyone. It's the first time in my life that I've seen the healthcare industry financially hit, you know, hospitals going bankrupt, doctors being laid off. And it's absolutely fascinating, and it's created a ton of empathy and interest in our space. You know, we've been calling for telemedicine to happen for 20, 30 years. I mean, we've had it since astronauts you know, we're trying to figure out what happens if they get sick in space. You know, we've had the concept for decades, but you know, why now, right? So it's an interesting change. It's a positive change. I just wish it didn't take a global pandemic to do it.
Thank you, Joseph.
So maybe someone has questions or want to tell us anything.
Yes, it's your time now. If you would like to ask something or know something. Hi,
But maybe, Anna, you can tell us about next battles. What is the news?
If you're the boss, if you say so. Next battles that I'm really encouraging everyone to visit is we will be having MENA region plus Africa already this Thursday, and everybody is welcome to join us. And next week we're gonna have Europe, FinTech, and General Battle in North America. We'll be having till our finals on the 20th of November. Save the date in your calendar. We'll be having each week 2 battles, Tuesday and Thursday. These are the days for our battles. And so please welcome to our site to see the updates. I'll publish in a second the link in our chat. And of course, we are welcoming everyone to join us. At our battles, we will have prominent startups from all over the world showing you the best solutions for you to invest in. So good luck and thank you.
Thank you. And I
say
want to mention that, dear judges, you can join our next Asian battle on October 1st. And if you have a time, please ping me or Dana by mail, and we will add you to the judge board.
Which one it will be?
Also, we will send you in personal invitations for Asia event.
It will be general battle. All startups are welcome to apply.
On the October 1st, yeah, in Asia.
Yeah.
Okay.
Okay, I can say a few words. So this is Gary Fowler. It's great to be on the panel today. And it's encouraging to see these incredible startups and our illustrious panel of investors. I mean, this is really an incredible time for us. I just read an article in Forbes called Nikola Tesla's Dream Comes True, the democratization of opportunity. And that's really what we're talking about today. Think about how our lives have changed in the last 7 months and how this digital transformation has had a tremendous impact on each and every one of us. This is also a great time for opportunities. It doesn't matter where you are, Dubai, the US, Russia, Ukraine, doesn't matter, European Union. This is an incredible opportunity. And I'm encouraged by seeing the telemedicine initiatives that are out there. I hear about them every day. I sit on anywhere from 1 to 3 panels as an investor, as a venture studio. So it's an incredible time for all of us. And so these two worlds that we're working in, the physical world and now the virtual world. Last week, I was writing back and forth to Eric, the founder of Zoom. I was one of the first Zoom users years ago. And here we are, right? 350 million daily active participants. Our world has changed. And each and every one of us are on this call that embrace that change. Each one of the investors is step out of the box and say, you know, I'm willing to meet with these startups without seeing them in person, and I'm willing to invest. They're going to win. They're going to win because this is not going to change in the near future. I mean, we're in a new reality. And so I'm honored to be here. Thanks for the invitation. Thanks to the judges that have already reached out to me and incredible startups. Look forward to working with you.
Thank you, Gary, for sharing that with us. Wonderful to have you as always. And thank you, everyone, for visiting our Healthtech battle in Asia and Australia, and see you at our next battles.
Bye.
Bye-bye, everyone.
Bye.
Yeah. See you.
Bye.
Bye-bye.
All right. Thanks, everyone. Bye-bye.
Bye-bye.
Thanks, everyone.
Thanks. Bye.
Thanks, everyone. Bye.
See you guys. Bye-bye.